Men, it's time to take care of your health. And women, there are 3 health screenings that you should be sure the man in your life is getting, because men always, well, not always, a lot of times put off going to the doctor. I don't know why. Dr. Daniel Wendorf is with Mount Carmel Health Partners. And thanks for coming in today.
My pleasure.
We're going to put Pete to the test, and he's already signed his waivers and everything.
He's signed all the
screenings, that's right.
So let's start with the heart. What are the important things to remember about, checking out the old ticker?
Well, heart disease is obviously critical. It's the #1 killer of men in the United States, and the CDC actually has determined that fully a quarter of the men who die from sudden death have some sort of coronary disease and didn't even know it.
What are the screenings that you do?
Well, you can't tell heart disease
The
until...
most important thing is to get into your doctor, because your doctor will do a wellness exam, a physical exam, and as part of that, we'll do a blood pressure.
Can you do this through my... Do I need to remove the jacket, or will this work here? Okay.
No,
I'll be the guinea pig.
Guinea pig.
Guys, I'm doing this for you.
We put this on, we pump it up, put a stethoscope here, bring it down, gives me a blood pressure reading, and then I can tell you whether your blood pressure is above normal, which would be 140/90 is the number that we would use.
So that's like anything above that, you could be problematic.
You could be at risk of heart disease, and we want to take care of that.
And what is this thing?
This is a point-of-care monitor to check cholesterol.
Oh,
It'll take 1 spot of blood to put on the monitor and give us a cholesterol reading. Now, in my office, you'd get a blood test that would go to the lab, and you get a full lipid profile.
Now, what's good for cholesterol and what's bad for cholesterol? Like when the
total cholesterol of 200 is considered the upper limit of normal. We want your LDL, your bad cholesterol, to be 130 or below for a normal person, and if you're diabetic, that would be 100 or less.
And if these things come back and they are kind of high numbers, that's not, like a death sentence or anything. There are ways that you can treat these things.
It is not a death sentence. It's certainly treatable, and it's the thing that we want to go after.
Now let's shuffle down here.
Sure.
And one last thing on cholesterol, you could be the healthiest person in the world, exercising, running every day, and still have it, because part of it's hereditary, right?
Very much of it is hereditary.
And some of
a lot of it's genetics.
Now, this is probably the worst part about going to the doctor.
Well, I just want to say, don't fear the screening.
I'm not going to lie, I kind of do, Doc, because you came in with toilet paper.
Yeah.
Colonoscopy, very important.
Colonoscopy.
So if with no additional risk factors, we suggest at age 50 you start having colonoscopies. Okay. This is a Go Lightly prep. It's a bunch of salt in there. You add water up to this level. You drink it all down.
That whole thing?
That whole thing before the procedure.
Wow.
Most of my patients tell me the prep is worse than the test. They don't even remember going through the test. They sedate you. You feel great afterwards. But this is important to do so that they can get a good look. Most cancers start as polyps in the colon, and it takes years for those polyps to turn into cancers. If you can find them early and remove the polyp, you can do away with a cancer, and we turn from cancer treatment to basically taking care of it before it's turned into cancer.
All right, let's shuffle down the end of the table, because we have about a minute left.
Next one is obesity.
And what is that? What I think it is?
That is a pound of fat.
Whoa!
That's what a pound of fat looks like. Pete, let me take you here.
I'm gonna do a little.
This could do some damage.
Okay, yeah. Patient-doctor confidentiality is in effect for that number. Basically, what we do in the office is we check during your physical exam a height and a weight. We use those numbers to determine what's called a body mass index, or a BMI. The BMI, if it's above 30, you're considered obese. Yeah. Below 30, you can be overweight. You can be normal. And
how do you figure that out? It's like height, weight.
Height and weight. That's all it takes. It's a formula that was developed by a German scientist.
But how accurate is
more of this?
A lot of people say, "Oh, I'm obese," when they look fine.
Yeah, and we used to talk about big frame, small frame. All that's sort of gone away, and we're basically dealing with just the body mass index. And there's been good data that shows that the body mass index is a good indication of whether you're going to develop problems from your obesity. And one of the big ones for that is diabetes. And so during your physical exam, you'll also get checked for your sugar. If you're obese, you have much more chance of developing diabetes. So diet and exercise, those are the big things that we recommend to decrease obesity. But if that doesn't work, there are many programs out there that can
help. A lot of these actually can kind of tie in together.
Everything.
Can't
they also tie in at your wellness exam. All of these things will be discussed.
So men, pick up the phone, make that appointment today. Dr.
Or women, make it for your man.
There you go. Thanks for coming in.
My pleasure.